Good morning. I am presenting paper on proportion of dry eye and its severity in individuals with pterygium. The aim of study was to determine the proportion of dry eye and its severity in individuals with dry pterygium, and it was a cross-sectional study done in individuals with pterygium attending the OPD of ophthalmology, and the sample size was 70. The study period is from December 2020 to May 22. The inclusion criteria was eyes with pterygium and excluded recurrent pterygium, usage of medications like lubricant eye drops, drugs that likely to increase the severity of dry eye, and topical anti-glaucoma medications, systemic diseases associated with dry eye like Sjogren's syndrome, contact lens uses, adnexal disease which alter the tear secretion and stability, and past history of ocular surgery. The procedure was first informed consent was taken, demographic history taken, and anterior segment examination followed by dry eye evaluation, which include the tests like Schimmer's test 1, that is without paracaine, and it assessed the baseline and reflex secretion. Schimmer's test 2 with paracaine assessed the baseline secretion. The tear film breakup time was the interval between the last blink and the appearance of first corneal dry spot. And tear meniscus height, a reading of less than 0.25 mm is considered as dry eye. According to National Eye Institute workshop grading system, the dry eye was diagnosed as one or more positive clinical tests and also the symptoms. But in this study, I have only assessing dry eye by objective methods. This study used Schimmer's test 1 for grading the severity of dry eye. According to dry eye workshop grading, it has the severity of dry eye according to Schimmer's test 1 was graded mild more than 10, moderate less than or equal to 10, severe less than or equal to 5, and severe disabling less than or equal to 2. The statistical analysis was done with SPSS version 20. Categorical and quantitative variables were expressed as frequency and mean standard deviation. The chi-square test was used to find the association between categorical variables, and p-value less than 0.05 is considered statistically significant. The result was 63.3% has got dry eye, that is 50 eyes had dry eye, and 36.7% do not have dry eye. And severity based on Schimmer's test 1, 29.1, that's 23 eyes had mild severity, and 26.6%, that is 21 eyes had moderate severity. Discussion: in patients with pterygium and other degenerative lesions of bulbar conjunctiva have tear film dysfunction. There is increased risk of dry eye symptoms in patients having pterygium. A study done by Manas et al. From Jammu and Kashmir in 90 pterygium patients and 180 age mass X control, they reported a strong positive correlation with a prevalence of 58.89% of dry eye in pterygium patients. A study by Ishioka M. et al. Showed that significant reduced value of Schimmer's test with anesthesia in pterygium patients. A study by Rahman et al. And Anthony et al. Had found that in unilateral pterygium patients showed that Schimmer's test value was significantly low. Kerka et al. Showed that tear osmolality and tear film functions improved after pterygium excision and worsened again with recurrence of pterygium. Conclusion: according to this study, there is a strong positive correlation with the prevalence of 63.3% of dry eye in pterygium patients, and the severity of dry eye in patients with pterygium according to Schimmer's test was mild and moderate. None had severe dry eye. These were my references.
Why do you get dry eye in case of pterygium?
Because dry eye can cause tear film instability.
Why?
Because it's an conjunctival overgrowth which can alter the tear film dispersion on the ocular surface. The ocular surface disease which can affect the tear film layer.
You have shown Schirmer test, no?
Yes.
Why we don't get any Indian patients? You have shown some other foreigner patient, no? That picture,
Yes.
photo.
Why did you not take your own patient photo? Why did you take it from internet?
In the consent, I have not mentioned about I have taken a photo of the patient. In the consent, it's not mentioned. So
Was it
Then
a
how did it-
copyrighted image what you showed?
that's picture from the internet, sir.
No, no.
Was there copyright violation in that?
Yes.
Okay. Let it be very clear. Is it the dry eye which is causing the pterygium or the pterygium causing the dry eye?
Actually, it is not yet proven which is the first thing which occurred.
Why did you not compare it with the other eye without a pterygium? Then you could have
I
got
have done both eyes,
Yes.
unilateral and
bilateral.
yeah.
Bilateral pterygium, but
No, I'm
Normal
asking a patient having pterygium in one eye. Did you compare it with the other eye?
Yes, sir.
What is your study in that? What is the conclusion
The
in that?
eye with pterygium have reduced value for Schimmer's test.
What is the difference between Schimmer's 1 and 2?
In Schimmer's 1, it measures basal and reflex secretion, whereas Schimmer's test 2 with topical anesthetic only measures the basal secretion.
What is the length of the Schimmer's?
30 mm.
What is the significant dry eye? What will be the, what is
If
the
it is
cutoff?
more than 15, it's normal.
More than 15 is normal, less than 15 is it the basal or the reflex? You are talking about this.
In
15.
Schimmer's test 1, it is both basal and reflex.
that means I am telling now, because you have put Schirmer 1 without anesthesia,
Yes, sir.
that means you have put the paper.
Yes.
It itself can irritate. They might have had a reflex secretions.
Yeah, actually Schimmer's test have less reproducibility. It can vary at each time. The test itself value is not that reproducible.
Then why did you check Schirmer test and all in these cases?
Because it is the modern technologies like TFL osmolality that are not available in our college. So it is Schimmer's test as it is easily available.
Do you know what is surfer's eye?
Schaffer's sign.
Surfer.
Sulfur.
Surfer. SURFER.
Surfer's pterygium. Pterygium. Yeah.
No.
Pterygium.